For this section of the video, we're going to talk about feedings. The goal is to promote safety and the positive growth of our patients. Babies should be fed every 3 hours. Babies should also not be fed for over 30 minutes. For them, feeding is like a workout, so it burns a lot of calories and uses up a lot of energy. As far as the volume your baby should be getting fed, follow the MO, CO, or nurse in charge's order. Another good reference to keep in your back pocket is the Kenya Comprehensive Newborn Care Protocols book. Breast milk is the best choice for your baby for feeding, but in the case that mom cannot produce enough breast milk, the other alternative is naan. The recipe for making naan is 30 milliliters to 1 scoop of naan. It's important to know if your baby is ready to feed, and usually the baby will let you know by crying and being very awake and alert. Even if the baby is not awake and alert, crying, and ready to orally feed, they still must be fed every 3 hours. If the baby is not ready to orally feed, you can proceed with an OG tube or NG tube feeding. You can use the OG tube and NG tube even if the baby is asleep, but the key thing to keep in mind is that you should never feed a baby who is sleeping orally, whether that be via cup, syringe, or breastfeeding. So now we'll actually get into the feeding part of the touch time, which is something that you'll do very frequently as a student. So I have neonatal here, and she has an OG tube in. The first thing that I've done is made sure that Natalie is stable. I've also made sure that the dressing on her face is secure so that the tube doesn't come out of her mouth when we're trying to feed her. And then the last thing I'm gonna do is make sure that the tube is in the right spot. So with my syringe and a stethoscope, you'll want to pull up 1 milliliter of air, connect it to the port of the OG tube, and then you'll put your stethoscope over the baby's stomach and push the air in, and you should hear a whoosh sound in the stomach. And if you do, then the OG tube is in the right spot. So then I'll take this out. Natalie is stable and ready to eat. So I have mom's milk here, and I'm going to drop 10 milliliters of her milk. Attach it to the end of the OG tube. And then let it flow. Something to keep in mind with these OG tubes is they're generally a size 8, which means it's a bigger tube, so the milk flows really fast. So whenever you're feeding, you want to go very slowly and only do 1 milliliter at a time, and then clamp the end of the tube once you've given 1 milliliter. And just go very slowly with the feed to make sure that the baby doesn't vomit. Okay, so we're continuing to feed until the milk is all done, and you're just going very slowly. Throughout the feeding, you're monitoring Natalie's stability. Now we'll talk about syringe feeding. Similar concept of you want to make sure Natalie is stable and awake and alert before you start. And I have mom's breast milk here, and I'm just using a 10 cc syringe. And then we'll start with the feeding. I have a blanket here just in case she starts to spit out milk or she vomits. And I'm just going to slowly put in mom's milk, going very slowly again, 1 milliliter at a time. You're continuing to monitor Natalie's stability throughout the feeding. Something to keep in mind is that during a feeding, a baby might need to burp. So if they start not doing as well during their feeding, you can try to sit them up like this. Put your hand under their chin and then burp them. And sometimes that helps them with their feeding because they'll swallow a lot of air, and sometimes they just need to get that out. So after you've burped them, you can continue with the syringe feeding. And if you notice Natalie is in a side-lying position instead of laying on her back, that's a safer position for feeding, so that if we're going too fast, the milk will kind of just pool in her cheek right here, and she can kind of pace herself. As students, you interact with the mother of the baby a lot. So it's really important that throughout her baby's stay in the NBU that you continually educate her. One of the most important things to educate the mother on is that if her baby stops feeding or eating well at home, that is a true emergency and that she should bring her baby back to the hospital immediately for review by an MO. That concludes this video about feeding. I hope it was helpful, and I'll see you guys in the next video.